So, but also, but it is said that a psychiatrist can at least notice your behavior and can know with the kind of behavior that you are having, or the kind of postures that you are using while you are speaking with someone. So they can actually tell what is going in your mind and what you're feeling actually going through. So, when a person is actually mentally ill and is going through certain phases in their life, I'm actually talking about mental health. So, what behavior should we notice, and if that person is not able to tell us, and if the person is a bit hesitant to actually accept it and accept the fact that they are going through these problems, so what as an individual should we look in that particular person, in their behavior, to tell them or to actually make them realize, so you are going through these changes, so you should be you should now consult to a psychiatrist, or you should go see a psychiatrist and you should take a session with them.
Right. I think, this is a very difficult question to put it in very little words, but I'll still try to put it because there is a variety of illnesses that we deal with, and each illness has a particular presentation. But otherwise, also, the major dimensions that we should be looking at is first physical, mental, and social well-being. This is the definition of health. So if somebody is physically fine, mentally fine, and socially fine, that is when we call them healthy. And if any of these dimensions start getting affected, that is when we should be thinking that there is something unhealthy about them. And when
Okay.
it comes to mental health specifically, the few dimensions that I would like to look into is one, the biological functions. Like I said, if somebody's sleep or somebody's appetite related behaviors are getting disturbed, like somebody could be telling you, I'm not really able to sleep well. That could be the only presenting issue. Somebody
Yeah.
could be saying, I hit the bed by 10 o'clock, but I don't get sleep till 2 in the night. Or somebody could be saying, I fall asleep, but I get up many times. Or I'm wide awake 3 a.m. So, somewhere, a change in the biological rhythms of sleeping habits or eating habits could be a warning sign of something happening, inside the brain. Next, looking into their professional lives. So, somebody who's energetic suddenly starts feeling lethargic. Somebody who used to be always within people loses interest in the best of the activities they do. Like
Yeah.
someone who used to like to enjoy to go and play tennis in the evening, now all of a sudden is sitting inside the four walls, not wanting to meet people, not interested in making new friends, not wanting to go out to watch movies, not spending time with family. So somewhere when his personal, relationships are getting disturbed, or
Yeah.
his professional abilities are getting disturbed, like easily getting distracted, not able to focus. A lot of times we do notice this in our work. When we see somebody who's not having the right attention, not focusing, losing concentration, lost in some thoughts. So, all these somewhere, like I said, the biological changes, professional changes, personal changes, changes in their social interactions, the way they used to interact, all of that comes less or becomes less. So all these dimensions are something that we should always be noticing. And like you were talking, you were telling about how a psychiatrist understands, through somebody's behaviors or postures. This is exactly what we do in our MSc, that is the mental status examination. We
Okay.
observe every minute detail, even from if the individual is trying to maintain an eye contact or no, how the thoughts are, how relevant the thoughts are, how is the flow of thoughts? Are they like really shifting from one thought to the other? How is their mood while they talk to us? Is it being stable or is it very unstable? And are they perceiving things around them fine? Somebody could be having hallucinations where they
Yeah.
perceive abnormal things. Somebody could be having delusions. So we try to look into each aspect, from how they talk, how they walk, how they express, and normally also all these dimensions are something that we should be looking at. And if we find a disturbance in any of these things, I think that is when we should be asking them if they really need some help, if they have been doing fine. And always asking an open-ended question is better than asking a closed question. So open-ended question helps them to express more about themselves. And before that, I think we should be able to create that comfort, even if it is our own friend. For
Yeah.
them, all of a sudden talking about their mental health might look like a stigma. So
Mhm.
first, giving them the comfort, giving them the confidence, telling them that, probably they themselves have faced something like this, or they know somebody who's faced something like this, and
Mhm.
there is help in regards to these issues. And then gaining the confidence and trying to understand is
Mhm.
something which all of us should be well equipped with. This is something very important which all of us should be trained with. Especially, I'm saying this because we see a sudden increase in the mental health issues in the last 1 decade.
Yeah.
Yes, sudden spike in mental health issues, especially in the last 2 years from the time COVID has come.
Oh,
So
yeah, true.
these knowledge about all of this is a must in today's world.
Yeah, absolutely, absolutely. But Dr. Vinci, also, when we actually come to know and when we realize that a family member, a friend, or a sibling is going through such problems and such phases in life, then what should we, as a friend, as a partner, as a parent, or as a sibling, should do for them in the home environment? I mean, at the home level, what can we do for them?
I think the most important thing is to give them a shoulder to cry on, or a ear to listen to, because a lot of times these people have been piling up a lot of emotions which they are not able to express, and I say that venting out emotions is as nice as how a schoolboy would feel when he would come back home and get that heavy bag off his
Yeah.
shoulders and put it aside. So the kind of relief that that boy gets is exactly what the relief an individual gets when they vent out their emotions. And being non-judgmental, listening more to them, not jumping into conclusions, and telling them that this is a phase and this is not them, this is the illness inside them, is going to boost a lot of their confidence. Secondly, suggesting them that there are mental health professionals who could be dealing with this and trying to destigmatize the whole mental health issue. So, a lot of times when youngsters come to me and they have a diagnosis, and when I have to tell them, I do see, them worried about being, labeled with a diagnosis. So, the simple thing I always tell them is, if I buy a new car and I never use it, if I keep the car only in the garage, the car would never get any repair.
Yeah.
But when I start using the car, there would be services that the car needs. The car
Mhm.
regularly needs fuel. The tires get worn out, so it needs repairs.
Yeah.
So similarly, it is with the brain also. When you're not using your brain, there are no repairs. When you use your brain, there are repairs. So we should never shy off thinking that I have a mental health issue. You should proudly tell yourself that I have been working, my brain has been working, and there are repairs. It's something like if I sit home and watch the India versus England cricket match, I will never get an injury.
Yeah.
But when I go onto the ground and I start playing, I will start getting injuries. So injuries to brain are as common as physical injuries, and repairing these injuries actually is going to improve a lot of their life. So destigmatizing by saying such examples or saying these things is actually going to ease them to come down to a mental health professional. And once they come to us, we follow a pattern, a proper systematic module where we educate the patient first, we try to educate the family members, and then we start off with some treatments. So all of these things can be done in a simultaneous way.